Title screen: Supported Decision-Making and Healthcare and Medical Treatment Decisions. What is supported decision-making? Michael Kendrick.
Supported decision-making is a way to support people so that they can make decisions by picking supporters that they trust on particular topics.
Richard Lavallo.
Supported decision-making is an alternative to guardianship, where a person with a disability can get assistance from a relative, a friend, or anyone to assist them in making decisions. And that ultimately the person with a disability makes the decision, but the supporter is someone like an advisor that helps them answer questions or provide information, but they are not the one making the decision.
Dawn and Belinda Carlton.
Well, you give a person the opportunity to make a decision.
Title screen: What is the role of the supporter? Beatrice Degree.
It's okay to have someone to support you in your decisions, to get a little help from somebody. It could be your aunt or your mom or dad or anybody.
Michael.
Not imposing a decision on a person, but giving them as much space as possible to be the person that ultimately makes that decision in an informed way.
Thelma Green.
The supporter should remember that is the person they're working for that make the decision, not them.
Title screen: How does supported decision-making work at the doctor's office? Dr. Cynthia Peacock.
What I tell the patients is you're making the decisions, but you're just identifying somebody that's going to help you in case you have questions about what you're making the decision about. Sometimes if we're asking Beatrice, it may be complicated. And so I think Beatrice would turn to her aunt to, get some confirmation about it or get some support about how she wants to do her care. It might be a complicated procedure we might be doing, or maybe a medication we want to give her, and she'll need to talk to her aunt about that.
Beatrice.
It doesn't matter what you said. If my aunt says I can make it this, if like people told me I have to make a decision, I'm going to make a decision.
Dr. Peacock.
We really try to facilitate, where the patient is at time and how well that they understand what we're trying to ask that they participate in. So we're participating in care plans, healthcare plans. Asking them to participate in their healthcare is giving them quality of care that otherwise they may not have had in the past.
Richard.
One of the problems as an advocate who's represented people with intellectual disabilities is that often medical professionals and mental health professionals don't listen to people with disabilities. And they're basically just telling them what they need to do.
Dr. Peacock.
We had one young man who was given a diagnosis of cancer. He got to make the decisions when and where and how he was going to participate and when he was going to get his treatments and what his life was going to be, and like, I'm going to do basketball before I go get my chemotherapy.
Thelma.
I suggest that doctors and nurses should talk to the individuals, the patient, the one that's coming for the help, instead talking to their supporters.
Dr. Peacock.
An individual with an intellectual disability sometimes can struggle in a doctor's appointment, maybe fearful of what's happening around them. Maybe they weren't given enough time to understand and to participate in the discussion and in the visit. So maybe an individual provider out there has maybe an implicit bias about that individual, thinking that they can't make a decision, and then and makes that decision maybe in a couple of minutes of the visit, and then turns to the family member or the provider that's with them.
Thelma.
The doctors and stuff need to take a step back and talk and take time to listen to the people, because everybody can't talk verbal like me or can't talk as fast.
Dr. Peacock.
If someone has to sit and think about a decision and they have to confer with their family member or who they've anointed as their supported decision maker, you just may have to leave the room and let them spend time talking about it, go on and see another patient, and then come back.
Thelma.
Maybe they might have speech problem because of their cerebral palsy, or they might had a stroke or whatever that slowed them down. everything is so fast nowadays, like a computer. They need to take a step back, like typewriter age, and really listen to those who really trying to get their point across and get their voice heard in a lot of other ways.
Dr. Peacock.
Or it may be something you take home and you come back the next day or the next week. There's nothing to say that you can't see that patient again and again, 2, 3, 4 times before that decision is made. I think that that's something that providers don't really think about when it comes to, you know, oh yeah, I could just have them come back and we can talk about it some more. They want that decision there and now, and then we can get on with whatever's going to happen.
Michael.
There's still hard things in decision making that supported decision making. It makes a lot of it easier, but it's still intrinsically, some decision making is intrinsically going to be not straightforward and stressing of the person, and difficult to be sure you made the right decision.
Thelma.
Sometimes doctors look at our equipment before they look at us as a human being and a person.
Dawn and Belinda.
We have to give them the opportunity to be a part of the world and take chances and make mistakes and
fall and get back up.
Beatrice.
When I get older, I have to be making decisions for my kids.
Special thanks to Dawn Carlton from Austin, Texas, and her supporter, Belinda Carlton. Beatrice Degree from Houston, Texas, and her supporter, Joelle Coleman. Thelma T. Green from Washington, D.C. Michael J. Kendrick, Ph.D. of the Center for Public Representation. Richard Lavallo, Jeff Miller, and Patricia Anderson of Disability Rights Texas. Dr. Cynthia Peacock and Samuel Garcia of the Baylor College of Medicine. Keegan Warren Clem of People's Community Clinic. Morgan K. Whitlatch of Quality Trust for Individuals with Disabilities. Produced by the National Disability Rights Network. Tina Pinedo, Communication and Digital Specialist. David Hutt, Managing Attorney for Community Integration. The production of this video was funded by a grant from the With Foundation. The contents do not necessarily represent the official views of the With Foundation. This video is for informational purposes only and not for the purpose of providing any legal advice. Copyright 2019, National Disability Rights Network.